Hello to all of my providers and my forever mentees. This is your girl, Coach Brown. Been getting a lot of emails about opening up a mental health facility offering supervised living as well. So if you are one of those providers that has reached out or has been intrigued about doing any of the such, please listen up. Opening a mental health supervised living facility that offers wraparound services through Medicaid involves navigating a complex landscape of federal and state regulations. First, you must understand Medicaid and wraparound services. Wraparound services are comprehensive, individualized care plans that address the multi-faced needs of individuals with serious mental health conditions. These services are often funded through Medicaid waivers, such as the 1915I or the 1915C, home and community-based service waivers. These waivers allow for the provision of non-institutional services, enabling individuals to receive care in community-based settings. Number two, you must establish your business entity. Before applying for a licensure or Medicaid certification, a legal structure must be obtained. Register for your facility as a legal entity in your chosen state. Of course, your tax identification number, liability insurance, along with staff qualifications, which must ensure that your staff meets the necessary qualifications, including appropriate licensure and certifications. Number three, is time for you to navigate state-specific licensing requirements. Licensing requirements vary by state. So here is an example of some that I know right off the top. For Virginia, the Virginia Department of Behavioral Health and Developmental Services oversees mental health facilities. Facilities must coordinate with local community service boards for referrals and services. North Carolina, the Division of Health Service Regulation, which is also known as DHSR, requires providers to attend a new provider orientation and obtain a letter of support from the local management entity, managed care organization, which is LME or MCO, in the area where the facility will operate. Indiana, providers must be approved by the Division of Mental Health and Addiction, which is also known as DMHA, and complete specific trainings, including the Child and Adolescent Needs and Strengths, which is also known as CANS, C-A-N-S. This is an assessment and wraparound practitioner certification, which is also included as well. For the state of Florida, assisted living facilities with limited mental health license must coordinate with Medicaid managed care plans or managing entities to ensure residents receive appropriate assessments and case management services. Number four, develop comprehensive policies and procedures. This is where most of you struggle. Please listen up. Your facility must have detailed policies and procedures that cover client intake and assessment, care planning, documentation, maintaining accurate records of services provided, incident reporting, health and safety, which is also protocols to ensure a safe environment for clients and staff. Number five is including staffing and training requirements. Ensure that your staff meets the necessary qualifications, of course, and those will be licensed professionals, employ or contract with mental health professionals, such as psychologists, social workers, as required by your state. Please check your state rules and regulations. Wraparound facilitators should also complete a state-approved wraparound facilitation training. For example, Washington requires facilitators to have specific educational background and experience. Background checks is included. They are included. I do apologize. Conduct a comprehensive background checks, including fingerprinting for all staff members, okay? Number six, facility compliance and site inspections. Prepare your facility to meet state and federal standards. Safety codes. Ensure compliance with fire safety and building codes. Accessibility. Make necessary modifications to accommodate individuals with disabilities, adhering to the Americans with Disabilities Act, which is also known as ADA. Cleanliness. Maintain a clean and hygiene environment. Number seven, Medicaid enrollment and certification. To receive Medicaid reimbursement, State Medicaid agencies must apply to become a Medicaid provider through your state's Medicaid agency. Waiver programs. Enroll in applicable waiver programs such as the 1915I and 1915C that cover the wraparound service that we had talked about, earlier. Billing systems. Implement billing systems that comply with Medicaid requirements. Ongoing compliance and quality assurance, you guys. Maintain high standards at all times. Maintain high standards of care at all times. Regular training. Provide ongoing training for staff to stay current with best practices. Quality assurance. Implement quality assurance programs to monitor and improve service delivery. Audits and inspections. Prepare for periodic audits and inspections by regulatory bodies. Okay, so with that being said, I have given you a breakdown of how you can open a mental health facility offering supportive and supervised wraparound services. So with that being said, take the step-by-step process by liking this video, sharing and following along, and save it for your implement of knowledge and gain education as needed so I can be able to help you. If you are needing more assistance through this process, again, I am Coach Brown and I assist providers start, build, scale, and grow their home and community-based services, as I will be glad to help you do so as well.